At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome. My name is Donna Cryer. I am the founder and CEO of the Global Liver Institute, the world's largest liver patient advocacy organization. And I am so excited to have the opportunity to celebrate Donate Life Month with all of you and with our guests today. Amy Honeycutt is an organ allocation transplant coordinator at UC San Diego Health. Welcome, Amy.
Hello, thanks for having me. I'm really excited to be an expert in the field. I feel it's really close to my heart.
You absolutely are an expert in the field. You have touched transplantation in every possible perspective. And so although I introduced you with some of your professional credentials, like me, you came to this through a more personal connection. So can you tell us about your personal connection to organ transplantation?
Of course. So in my early 20s, I'd heard about transplant and I was like, oh, that's cool. You know, never really had a specific connection to it. And I decided to go back to school at about 25 to become a nurse. Everything was going along very smooth. I was working, going to school, having a great life. And when I was 26, I was started on a medication that has a very, very rare chance of liver failure. And of course, I was the rare one. We won't get into the, legality of it, but there was things that could have been done to, keep me a little safer. Ultimately, my liver did fail. It was acute liver failure because I had no prior liver disease, nothing that would, indicate me being that ill. So it was acute liver failure. I was at University of Kansas Hospital ultimately. I was listed on a Friday for a liver transplant, and I was listed as status 1A. Essentially, there's certain medical criteria that have to be met to be status 1A. I was in the
That
ICU.
means that you were really sick.
Very sick.
For those of you listening, you were really sick.
Typically, this is someone that is not going to live much longer. They've got a few more days at the most. Typically, they're very confused. The hepatic encephalopathy, all the ammonia in my brain, I was pleasantly confused from what I've been told, but that's a trip. That's something I can definitely empathize with. It's very, very hard. So I was very, very sick. I was put on the list on a Friday and got my transplant on that following Sunday. So very, very fast. I didn't entirely know what was going on. I thought it was shortly after Osama bin Laden was captured, and I thought that he was the president. So I was very, very confused. My poor family, what they went through to see, a healthy 26-year-old so sick, so fast, that, looking back was really hard for me knowing what they went through. But luckily I received a transplant. They found a young and pristine liver for me is what I've been told. And, that person and their family saved my life. I have almost an extra 12 years now. So I don't know my donor or their family or anything, but they're still my absolute hero.
Well,
So
you are living your life every day, honoring that great gift. So I'm sure they're looking down, and then the family is, if they knew, they would be just so grateful for what you're giving back to the community. But I wanted to underscore several things that you mentioned in your story about your experience that. Really go counter to several myths that people have about liver disease and transplantation. You were a young person. This came through a drug toxicity. So it wasn't alcohol. It wasn't something that, like me, who ended up because of an autoimmune disease, in my 20s, trying to go through school. It struck our families. And I think people don't realize that young people can get liver disease, that there are, so many possible causes of even this extreme end stage liver disease and liver damage. And so this really is something that unfortunately could affect anybody.
yeah.
Which is why everybody needs to listen and to be involved.
And what's interesting is you're more likely to be a recipient than to be a donor.
Yes.
That just goes to show, sometimes people's hesitancy towards donation is, well, I don't want to give my lungs to a smoker or someone who's abused their body or, whatever the case may be. But there's so many people who are out there that didn't do anything. And to be honest, the people that did do something, it doesn't mean that they haven't changed and are healthy now.
Right.
You're going to be donating to someone who's taking care of themselves at this point.
Absolutely. And that's part of the process that you now professionally, lead people through what is their, network to make sure that they're taking care of their, the organ that they've received, and have the support to take their medications and just make the best of it. So I think that should give donors a particular level of confidence that that's part of the entire process, to support the recipient and make sure that they can do the best with this second chance at life.
It's a huge part of the process, and people don't realize how they really put patients through the ringer. You really have to be committed. We tell patients it's a lifelong commitment. We have to see it up front. We have to see changes being made, and we're here to help you. Your coordinators are well aware that you don't know everything about that organ. We completely understand, and we want to help you change those things. We want to support you throughout, that first visit, that first evaluation until you're living with this transplant decades later. That's our goal. We want to protect that gift as well. So
what does your day-to-day look like as a transplant coordinator, and armed with this sort of secret superpower of knowing what patients are thinking and feeling and may have questions about? So what does your day-to-day look like?
So I can kind of touch on maybe a little bit on each role, but mainly my role now. So when I worked for the OPO, the Organ Procurement Organization, we went to different hospitals and we worked with the donors and their families. So if they weren't registered, we kind of walked them through the steps, educated them. We were there the whole time for the family, managing the donor from a medical perspective, and, matching with the centers. Essentially, like, that's very short.
Right. I understand, my father died in a hospital, in a stroke, in one of the, rare set of conditions that, you could then donate. And, our family knew enough to make sure that, the decisions were made so his organ stayed perfused, so he stayed eligible to donate. What do families need to know before they ever, experience, unfortunately, a loved one dying. Yeah.
I think the most important thing is that never rule yourself or anyone out. Age, we see beautiful organs come from people over 70. you know, and then we see some that are a little iffy from people in their 20s. Age is relevant, but it's not the be all end all.
Right.
Medical history is also not always that relevant. I mean, obviously, if you have metastatic cancer and certain things, but there's a lot of things that don't really play into that. I think, you know, my cousin was a donor, and he constantly said, no one's going to want my organs. I smoke, I drink, I, you know, have a history of IV drug use. You know, on paper, he might not look like the best donor, but he actually, he relapsed and became a donor, and his organs were great. His recipients have had long lives after. You know, he was actually a really great candidate. So I know, and luckily my aunt, kind of like you guys, was fortunate enough to know once there was no real recovery, she's like, he has to be an organ donor. He has to be an organ donor. So, and I think, you know, something else to remember is recipients and their donors don't always connect, and sometimes they do. And I don't think there's any right or wrong way or, you know, any judgment on that. I think you just have to give openly and not expect anything, and, you know, vice versa. I don't expect anything back from them. So,
right. You know, one of the things that I think is important as part of, you know, what you said, even if someone can't donate their kidneys or their liver, for example, they could possibly donate cornea. The donation process can benefit so many potential recipients, and it's not all or nothing. You know, the health of each organ is evaluated, and testing is, you know, going on for the donor to make sure anything is safely given to the recipient. But there's so many possibilities of making a difference through donation, that even if, you know, one organ isn't suitable, there may be, you know, other ways that can make a difference.
That's a great point. You know, a lot of times for livers, it could be a cardiac death. And while their heart may be, you know, really kind of out of the question, or maybe they're a little older, they have a beautiful liver, you know, or, you know, if it was an acute event with their heart, maybe their kidneys are fantastic.
Right.
So, you know, we have to look at that. And, you know, that's something that with my current job, my current role is allocation, you know, we have to look at it from every perspective. We don't look at the heart just as a heart. You know, we look and say, okay, well, the kidneys are functioning well too, or, you know, well, the lungs are kind of a mess, but, you know, the kidneys have survived, or, you know, it really varies. You know, maybe someone who unfortunately, you know, was a younger alcoholic may not have a great liver, but they might actually have a perfect heart. So it's a big variety. And when we look at that, we look at, you know, kind of everything top to bottom. And you'd be surprised, you know, that not everybody has to be in perfect health. You know, it's so rare that you die as a donor, and will die and meet the criteria to be a donor, that, you know, we're not only accepting, you know, great athletes and young, healthy people. So
that, I think that's good to know, because every family really should be having the conversation about, you know, what would happen if, and make their wishes known about wanting to donate, so that all the family members are comfortable with that decision, because it happens so quickly, that you know, I think we deserve the gift of, you know, of time and foresight to, you know, really know that this is something that is important, and we want to move forward to it in whatever way is possible. So, you know, there's so many depictions in the media about organ donation. No, I just there's you see the medical team, leaving to retrieve an organ, and they're taking planes and trains and automobiles and ambulances and traveling back in igloo coolers and is it anything like that? Are some parts true, some parts not? Is it that dramatic? What happens?
It can be. It really kind of is. It's never happens as fast as on TV. It's kind of like, a crime show. Cops or anyone will be like, it'll never happen that fast. It does not happen that fast either. Once the person meets criteria in the hospital, then they reach out to the organ procurement organization. They do a ton of testing to make sure everything is safe. Then, they send it out on the match run. It's a computer system that some genius designed from the back end that I can barely program my DVR. So yeah. And it matches it. The coordinators review it with the surgeons. The team does go out often. It's on helicopters. We joke with our team that, being in Southern California, they get to go these helicopter rides up the coast. And, and sometimes it's less glamorous. We had a team get stuck in Idaho in the snow. We don't, obviously, I'm sure the Midwest has way more stories of that and how they have to work around that. Being in Southern California, we're like, oh, weather, snow. So, but yeah, it can be like that. It can happen really, really fast. You put a team together really fast. It's typically not the whole, someone comes in, they're a little bit sick, someone in the next room is dying. That's just not a thing. The teams have to be very separate. Right. When a patient is pronounced brain dead, or they decide to move forward with donation after cardiac death, it can't be the transplant team that's involved. It has to be a very separate team. So it's very fair in that sense. There's, each organ has a different scoring system. And, they're placed on that based on medical urgency. They're not all always perfect, but they're the most fair that we can do. And having, money or anything doesn't get you anywhere at all. Maybe gets you a jet so you can be listed at different places, and that's it. It doesn't really do much.
And that was a big decision that, is debated by membership and professional standards at UNOS, whether patients should be allowed to double list, because we were aware of the equity implications of that. It was very hard to think through restrictions on what people can do to save their own lives. Whether it's, double listing, or some people have stronger networks. And so I remember seeing the first sort of social media appeals for, a donor. I think that the consensus was that the, added attention to transplantation and donation, often multiple donors sort of come out and become available for multiple people through the network or appeal of someone who is more savvy, or someone who is double listed. Well, then they're taken off, the transplanted, and there's a spot opened up for somebody who can't travel. So those issues are all, hotly debated, and until we solve the organ shortage, either through innovation like 3D printing of organs, or by fully realizing the absolute potential in any OPO region, those trade-offs and hard decisions are deliberated by a community that does have patient comment, and patient members and caregiver and donor family members and recipient members, as well as the scientists and transplant surgeons and other professionals. I think that's rare for any sort of process to have been built on that type of, iterative decision making that involves so many, stakeholders and was sort of, self-regulating in that way. But I think people need to know how many people are involved. Yeah.
That's one thing I really love about transplant is it's so regulated, but there are times where we have to make decisions, when I was doing strictly liver transplant and we would eval a patient, it's not very black and white. There's a lot of gray areas, are they sober? How high is their risk? Do they have, and not just risk of, substance abuse, but their cardiac risk, there's so many factors that go into play, and we make a lot of hard decisions, and, everyone has input and experience with that patient, and we have to really think about what's best for the patient and what's best for that potential donor. And it's not always easy. It's not always clear. I don't think anyone can say they've always done it right. There's just a lot of gray, and, it's hard, and we try to get better and better, but that's, transplant isn't black and white.
Right.
So
what are some opportunities for us to make that system better?
I think, we're really looking at a lot of the inequities, just, for liver, for example, there's issues with patients, women who were smaller, not getting livers because, a lot of the donors are bigger. A man can take a bigger donor or a medium donor, but the small donors are rare, and that's all that, a petite woman can take. So, and they find a lot of times it's in the Hispanic community. So they, have discussed things like, giving them extra points, for their MELD score, where they're scored on the list to be higher. There's multiple things like that. Lung, I'm not as familiar with the lung listing, but they just, kind of redid their allocation. Right. I think the fact that UNOS and everyone in transplant is open to change and trying to figure these things out and make it best for the community is so cool, because everybody is so invested in transplant. You're not there to make a paycheck. It's not a job like that. It's something that you really put your heart and soul into.
Right. There have been some controversies, and we participated in a House oversight hearing to make sure that those who were doing the job like you're doing it with your heart and soul and passion and best intentions and high performance and working closely with your community are highlighted and given all the resources that you deserve, but that those who aren't performing at the same standards, that there's transparency into that, and we can make sure that we are making it so that no matter where you live in the country, you have that best opportunity. I think people sometimes feel that they need to travel to a certain area because that OPO is performing really well versus where they are. And so I know one of the areas in which the community is working to make sure that geographic inequity is solved for, to the extent that it can, that everybody should have the opportunity to have someone like you working on their behalf and performing at just all that we know can be done, reaching out to every family 24/7. You talked about being listed on a Friday and transplanted on a Sunday, so that meant somebody in the OPO was working on the weekend and was doing all of those things 24/7. Because your need didn't stop at 9 at 5 o'clock or something like that.
No, it is constant. I worked Friday night and Sunday night, and then tomorrow I work swing shift. So I mean, my schedule's really variable, which works for me. But that's the thing is, you have to be so invested in this, and it takes people like you and I to kind of speak up for patients and to be their voice and to advocate, one way or the other. Sometimes we're advocating for the patient, and sometimes we're advocating for their safety or the best way we can, honor that donor that's such a limited resource.
Right.
So it takes a lot of people, a lot of time, and I really feel like transplant is one of those things that, the people that answer the phones are so important. The surgeons are so important. There's not, I don't want to say we're all on the same level or something like
but
that.
every part of the system
Exactly.
makes a difference.
Yeah. If you have that experience with one person,
how do you balance, as a patient and as a very, busy professional, particularly through COVID? I know I got a lot of calls from nurses with autoimmune diseases, nurses and ER physicians who are transplant recipients. Should I go to work? How do I go to work? When will a vaccine be available? That in addition to, can I get some sleep and exercise and eat right and do all the regular things? But how do you create, balance and sustain yourself doing this very busy job?
I think, COVID was a lot for everyone. Luckily, I had a lot of support at work, and, my close circle knows all about my transplant and all about my priorities and things. And I think if anything, it just kind of heightened that. I'm lucky to work with people who have personal transplant experiences, as well as just being great humans. And, my friends are like, hey, my kids all came home sick. Let's not hang out. They watch out for me and my weakened immune system. And, I think, getting sleep, taking care of your mental health is so important. I mean, other than organ donation, mental health is something that I really advocate for, especially for transplant recipients. So I think really taking care of that helps. We deal with things very different. COVID, just a lot of things are very different for transplant patients. We look normal and we seem, very, very high functioning, and we're all very high functioning. We have transplant patients have amazing careers, they travel, all of this, they work out, but I think, remembering that your body's a little different, you're going to experience things different. That's okay.
Yes. I think that, realizing that, transplantation is not, a cure in the same way that some other things are, that it's a daily maintenance, taking medication and, doctor's appointments, and even our screening schedule may be a little accelerated, because our risks for, skin cancer or osteoporosis or other things, are a little heightened. And so, making sure that we make those appointments are even more important, and perhaps have a slightly different schedule than other people. And so it's a maintenance, project. I feel blessed that, I have this opportunity to take care of this gift, and that perhaps I have a few, signals earlier than others that, what really matters in life.
Big time.
And so, what, looking ahead, what, are you hoping to see for transplantation, for patients? If you were to design your ideal, transplant, process or facility, what would it have? What would Amy Honeycutt's transplant center, have?
More nurses, always. The answer is always more nurses. Any nurse will say that. Anyone in healthcare will probably say that.
Yeah, I serve on a board, and that's my refrain as well. More nurses.
Yeah, I think other than more nurses, more mental health providers, for pre and post. That's something that every center kind of dreams of having that access. I think too, just more knowledge about transplant. So we don't expect the patients to come and know a lot. It's a whole other language, But I think just, more knowledge about transplant, because that's going to close the gap on the organ shortage. It's going to kind of make people aware of the impact that has, and how truly, kind of beautiful this whole thing is. I think, more awareness is great. More people just even touching on transplant. I'll never stop talking about transplant and how important it is. So,
well, you've done a great thing to make people more aware today, and I think that your point about you wouldn't be able to tell by looking at us that we've had a transplant.
Yeah.
So it's important for all of us to speak up and to tell our stories, and particularly, we live on different sides of the countries. We have different color skin. My hair is really just as curly as yours, but
it's like half black because the rain. But
there are so many. Every type of person has benefited from transplantation, and so everyone needs to know and can be part of these wonderful miracles, and thank you for helping me do that today.
Thank you. I'm so glad. I like I said, I'll never stop talking about transplant and donation, and this is a great forum to do it. So very happy to be here.
Thank you. Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.